Hello guys, hope you're all okay. You're all enjoying your life and you're also enjoying watching my videos. I do hope that everything would be all right on your part. So welcome back to ultrasound teaching videos with Dr. Arshad Nadeem Awan. Today my topic of discussion is Bosnick classification system. Bosnick classification system divides into 5 categories, and these categories help us to identify the cystic masses, benign cystic masses, indeterminate cystic masses, and also clearly malignant cystic masses. This category is usually applied on contrast enhanced CT. So far, the usage of ultrasonography is concerned, it's still controversial. This classification was updated in 2005, and it's widely used by the radiologists, by the urologists for assessing the clinical problems and helping either for the treatment or follow-up scanning. So far its gradings are concerned. So the main purpose of this grading is that it is based upon the numerical Roman numericals, not Arabic. So therefore you cannot apply the word of grading. That's why I intentionally use the word of grading, because during our clinical practice we use the word grading, which is incorrect. You cannot use the word grading, you cannot use the word staging, you cannot use the word group. It is the category. So whenever you are applying the terminology, try to use the proper terminology, that Bosnian category 1 or Bosnian category 2 or Bosnian category 2F, whatever. So this video will help you to identify all sort of Bosniak classifications, Bosniak categories, and related to this category, how you will differentiate that this cystic mass is simple mass, or it's benign mass, or it is indeterminate mass, or it is potentially or clearly malignant mass. So let's start watching these images, and this video, hopefully it will help you to identify the Bosniak classification, both on ultrasound imaging and also on the CT imaging. So let's start watching these images. This ultrasound image, you can appreciate a well-defined thin wall, lower pole, simple cyst. This would be categorized as a Bosniak category 1 because it's a simple cyst and it's a benign cyst. However, Bosniak classification is not for the ultrasound imaging, but those who are working side by side with the radiology and the ultrasound, they can pick the points on the ultrasounds as well. On the ultrasound category, it will appears to be a simple round anechoic cystic lesion with a smooth wall, and there will be no internal contents visible on the ultrasound imaging. Have a look to this CT scan. This is category 1 uncomplicated simple cyst. It will be having a thin wall, there will be no septation, there will be no calcification, there will be no rigid components, and it would be homogeneous water content with less than 20 Hounsfield density. Sharp delineation with the renal parenchyma. No contrast enhancement will be visible in this cyst. So far the malignancy risk is concerned, it is less than 1%, and normally there is no follow-up is required. If you see this on the contrast enhanced CT KUB, so you don't need to follow it up. And if you see this on the ultrasound image, so still on the basis of the ultrasound imaging, there is no further follow-up is required for the simple benign renal cyst. This is the ultrasound image of the renal cyst, and on the CECT or contrast enhanced CT, this would be categorized as a category simple minimally complex cyst. Why? Because it has a thin wall, less than 1 mm, and it has a fine septation within it. So you can appreciate this white arrow is indicating a fine thin septation. So if you come across such sort of a cyst, you must categorize this into a Bosnick category 2nd, and for the Bosnick category 2nd, again there is no follow-up is required. This is again a contrast CT image, and this is for the category 2nd Bosniak classification, which happens to be minimally complex cyst. There will be a thin wall, but it should be less than 3 mm. There will be a fine calcification. If you could see this white arrow indicating fine calcification, or there may be fine septations that should be less than 3 centimeter in diameter. There will be no contrast enhancement. So as you can see on this image, there is a thin wall, but there is a wall calcification as well, and if there would have any septation, you would have to label it as a category 2, but there will be no contrast enhancement in it. So for the malignant risk is concerned, that is happens to be less than 3 centimeter, less than 3%, and there is also no follow-up required for such sort of a cystic lesion, which should be fall in the category 2 Bosniak classification. Here comes the next category, which is still category 2, but it is 2F. On the ultrasound imaging, so for the presentation of the category 2F is concerned, and you can pick that on the CT scan as well, that would be slightly thick and irregular wall. As you can appreciate that on this image, the wall is slightly thick and it is irregular. There is multiple thin septations. There will be presence of calcification, and the lesion will be up to 3 centimeter in diameter. As far in this lumen is concerned, there is a 2 finding on the ultrasound imaging, that is a thick wall, and also there is a thin septa, but it's slightly thickened. However, the calcification cannot be visible on the ultrasound imaging, but it would be visible on the CT scan, and there will be no contrast enhancement on the CT. You will immediately look for the next slide. So far the malignant potential is concerned, this would be 5 to 10% malignant potential, and on the CT scan and on the ultrasound imaging, particularly ultrasound imaging, there will be follow-up required within 6 months time period. This is contrast enhanced CT for the category 2F, and you can appreciate that the wall is slightly thick and slightly irregular. Multiple thin septation can also be seen. Beside this, if there would have any calcification, this white arrow is also indicating the calcification, or this would be a dense lesion, 3 centimeter in diameter. There will be no contrast enhancement. So far the malignant potential is concerned, it would be 5 to 10%, and on the ultrasound imaging and on the CT scan, you need to follow this up within the 6-month period. So 6 months surveillance can be offered to this patient to look for any changes, like, because there is a malignant potential, 5 to 10% chances of the malignancy is there. So you have to look for the internal changes on the surveillance scan after 6 months. Bosniak category 3 happens to be more complicated renal cyst. It should be having a thick wall, multiple thin septations, presence of calcification, or happens to be dense lesion up to 3 centimeter in diameter. Here on this scan, you can appreciate this is more a complex cyst. It has a thick wall. Beside this would be slightly considered as a dense lesion inside the lumen. You can appreciate some echoes, dense echoes is visible. So it does not fall under the category of 1 at all. It doesn't fall under the category of 2 even, and even you cannot consider it as a category 2F because of its dense nature. So on the ultrasound basis, you can call it as a category 3 cyst, and mind you that category cyst. When you are calling it category 3 Bosniak cyst, it's mean that you are labeling that as a 40 to 60% susceptible for the malignant or potentially malignant for the malignant transformation. So this is what on the ultrasound imaging you will appreciate the cyst, and you should have to be very careful while you are giving the category system, and always advise the contrast enhanced CT scan of kidney KUB for further follow-up and for further categorization of the Bosniak classification. Here is a true picture of category 3 Bosniak classification, and you can appreciate that this is a uniformly thick wall which is clearly visible. Beside this, there might be a nodularity here. This white pointer is pointing out the nodularity within the septa. There is a multiple thick septation. There is a thick and irregular calcification around, and there is also contrast enhancement. So keeping these three characteristics in view, this would be categorized as a Bosniak classification 3, Bosniak category 3, and it has potential of 40 to 60% for the malignant transformation. And the important step and the workout is it should be surgically excised and sent for the biopsy. So this is what the category 3 Bosniak classification cyst will look like on the CT scan and on the ultrasound imaging. And the last category is category 4, and that is totally absolutely malignant cyst. On the ultrasound imaging, if you come across any intraluminal solid nodule, must think of category 4. And if there is a nodularity within the cyst along with the vascularity on the Doppler imaging, so this would be considered as a 100% malignant cyst, and this should be tested and this should be confirmed on the contrast enhanced CT images. So here you can appreciate this a well defined cystic lesion with its central intramural nodule. So on the basis of the ultrasound imaging, this would be classified as grade 4 category 4 Bosniak cyst, and will be correlated on the contrast enhanced CT images. So this is what on the contrast enhanced CT images. The one thing you have to notice, it's a large cyst, and inside there will be a large internal components, irregular margins, prominent nodules within it, solid enhancing element here, these white arrow indicating solid enhancing components and elements, more than 10 Hounsfield on CT density, and there will be an independent septa. So far malignant potential is concerned, it's more than 80%, so it means it's quite serious stage. So you have to have a surgical excision immediately for that, and you must refer this patient immediately for the surgical management, and mention that this is category 4, and on the Bosniak category this would be considered as a malignant cyst. So ultrasound being the important and earlier imaging modality, I'm showing you some of the images to just make sure that you can understand how this category 4 Bosniak cyst will look like. So here is the image, yellow arrow is indicating a complex cystic lesion. However, very little cystic components are visible, all intranodular, soft tissue, thick wall, thick nodularity can be seen. So this type of a cyst will be considered as not the cyst at all. This would be considered as a complex cyst, rather malignant cyst. So raise your suspicion and send it to refer it to the surgical department for further workup. Yes guys, this was all about the Bosniak classifications, and I have discussed at length the category 1, 2, 2F, 3 and 4. All these categories are quite easy to pick on the CT scan, and beside this, as I have also mentioned some of the ultrasound imaging, so that you can pick that while you're doing ultrasound scanning, and then you can confidently advise the contrast enhanced CT for the further classification. So regarding this Bosnick classification system, if you have any doubt or any problem, just drop me a message. Don't forget giving me your feedback with some other informative video. We'll see each other. Till then, take great care of yourself. See you then. Bye bye.